within each of those standards, there are forces of magnetism. These are elements that, if put into place within an organization, draws patients to the organization for the quality of care and for the environment. It also draws nurses and retains nurses because it provides an environment where staff want to work, hence the term magnet.
It is the Academy Awards of nursing. If you walk into a magnet facility, you can tell by the tenor, the tone of the organization the moment you walk in the door.
I think you can feel the energy. I think there's a different level of energy. There's certainly increased awareness among the staff as to why they've and how they've attained that level of excellence. And I believe that that excitement is imparted to all people who enter that building. As we bring together work groups like the Professional Advancement Group to discuss our journey, I'm starting to feel the excitement. There are lots of questions for which we need some responses and guidance, but there's definitely intense interest in moving that forward.
It affords the nurses, as well as the unit clerks, as well as the nursing assistants, the technical partners, the ability to self-schedule, which we feel is a real good predictor of being pleased with how they can orchestrate their schedules. It is all electronic. We also have the capability to do it remotely. So nurses can go home and look at their schedule or talk to their husband and determine, do they need a PTO this day? Their preference, would I like to be 3 to 11 that day? So it gives a lot of options for when and how you schedule.
It's literally an iPad where the providers, both on the sending and receiving side, can see each other as well as the patient, all at the same time. FaceTime took the nursing knowledge exchange to a different level by assuring safety in handoffs between providers, as well as excellence in care delivery, particularly the continuity of care, and made that process more efficient by allowing caregivers who were not in the same location to discuss the condition of a patient and the patient's needs going forward, and to allow for not only the subjective interpretation of the individual caring for the patient, but the objective evaluation of the nurse receiving the patient. But most importantly, engage the patient in the process by allowing them the opportunity to validate or clarify or just participate in general in that exchange.
The purpose of the nurse mentorship is for ongoing professional development of a new nurse. When a new nurse is paired up with an experienced nurse as a mentor, the mentor can expose them to situations and help them to work through problems that they may be having on the clinical unit. The mentor is not there to fix things for the new nurse, but to help him or her solve problems on their own. The nurse mentorship program helps nurses develop skills that they could use for their lifetime. The mentorship program allows new nurses to develop leadership skills, how to problem solve, how to make connections with other disciplines or other people within the organization that they would not normally have the opportunity to do.
To align nursing within the organization, nursing has to develop its own mission. For example, the staff have worked very hard within the shared governance model, and they've come up with a mission that is delivering on our promise to provide exceptional nursing care for every life we touch. And they'll provide that care based on 4 key values: compassion, accountability, respect, and excellence. They've also taken these words and they've actually turned them into concepts and direction for nursing that will, again, inspire and drive the process and the provision of care.
The Care Support Center services is a resource that provides support to the electronic scheduling component. Whoever the manager has identified to help with this process, we've minimized their responsibilities to this process, so it allows them to be out on the nursing units taking care of the patient while we do these clerical functions in lieu of them having to do that. The service, the department is used by all 3 campuses. It just happens to be centrally located at this campus, at the Westmoreland campus.
The Clinical Education Center is located at the Frick Hospital campus, and we were able to take the old intensive care unit and we removed the nurses station, but we kept all of the rooms, and we set up an education center where we currently provide orientation for the new nurses. That space is also used for skills labs and for ongoing education of the nurse residents. It's nice because we have an area where the nurses station used to be, and we have tables and chairs set up. So we have a classroom type setting, we have AV equipment, and then located in the rooms we have a lot of the medical equipment that we use for orientation. We have a mannequin in one of the rooms where we can do some low fidelity simulation. We do our IV skills labs there, so we have all of our IV equipment set up, and it's the perfect environment for providing orientation and ongoing education for nurses.
The collaborative care model launched here on our 2D unit. It is a patient care delivery model that was set up based on nationally recognized practices such as the interprofessional collaborative practices out of Theta Care, out of Project RED, which is a re-engineering of discharge practices, and also Interact 2, which is a process looking at acute transfers back into facilities from skilled care facilities. The collaborative care model is a model of care where the staff is very engaged and very team-based. They round on all their patients with a physician, with case managers. They also have the ancillary departments that participate in the rounding: pharmacy, the therapies, physical therapy, occupational therapy, and nutrition also round on these patients. Their day consists of standard work, so that from an RN, technical partner, unit clerk, there is standard work that is built into the day, so that the patient and the patient's family have expectations for what their care is. They utilize smart technology. They utilize iPads for face-to-face handoffs. They utilize smartphones when it comes to being able to communicate with other disciplines. They also utilize many of the continuous improvement quality measures. The 2D unit to date has been very successful. Our quality measures and our HCAP measures and our nurse-sensitive measures are trending in a positive direction.
The magnet process is very prescribed, but we would need to provide the evidence as to how we carry out the standards. So although it's prescribed, we adapt it for use here at Excela.
The one person who is picked, an RN from each of the different campuses, including home health, is then honored at a dinner in November at the David L. Lawrence Convention Center, along with approximately 145 other facilities that bring their shining star of a nurse. It's kind of the Grammys for the nursing. You go up and you are highlighted. They do a very nice video story, on you, on your life, and on your accomplishments, and on your peers, and on your organization. And so what we do is we all go. We all get dressed up and we have a great night celebrating nursing.
I'm very impressed with the nurses here at Excela. I think they work very hard. I think it's complicated work, but I am impressed with the knowledge that the nurses bring to the patient, because it's all about knowledge, turning that knowledge into skills, and having the right attitude. And that reverts back to the Excela behaviors and how we put that into practice. Every new graduate, when they get out of school, needs to come into their first job in a way where they are welcomed, they are coached, and they are inspired. So what we are doing very consciously is creating a program for nurse residents where we can help them and support them to build themselves first as a professional, then as a clinician, and then as a leader.
Certified nurses generally obtain certification through their professional organization, and it validates their knowledge and the application of that knowledge in their field.
In 2013, we had 100 certified nurses at Excela, and as of March this year, we have 130. So I see this increase just moving along at a steady pace, and certainly it's a great opportunity for us to showcase our nurses to validate their knowledge, expert knowledge in their particular specialty field.
Although Magnet is a nursing designation, and the process will be led by nursing, it engages the entire organization and it crosses all the disciplines. So nursing can't achieve Magnet in and of themselves. It must be an organization, an organizational process, and it's driven across the organization. I am very proud to be a part of the nursing team at Excela Health. I'm proud to be a part of the entire care team at Excela Health. And when I first came here, I thought, I'm going to be the best CNO I can be. And then I came to realize that although that is my role, I also have to be the best team player that I can be, because none of us can do this alone. And it takes the input and the stamina and the engagement of every person in this organization. Everyone has their own role, different but equally important. And when everyone pulls together, we'll get the outcomes that we need.